Intro. You are in the NICU, and you walk over to see your baby. But instead of the closed, clear plastic box you might have pictured, an incubator, you see them resting peacefully on an open bed, with a gentle heating element overhead. You might be wondering, is my baby warm enough? Why aren't they in an incubator? It's a completely normal and common question. The answer is that your baby is being cared for in a radiant warmer, a device designed to keep them perfectly toasty while giving our team, and you, easy access for all the care they need. So, let's break down what it is, why we use it, and how it works to keep your baby safe and comfortable. Section 1. What is a radiant warmer? So, what exactly is this open bed? A radiant warmer is a medical device that provides a controlled, warm environment for newborns. Think of it as a personal, smart heating system designed specifically for your little one. Its main job is to maintain a baby's body temperature, which is incredibly important for their health and growth, especially if they are premature or sick. Unlike an incubator, which is a closed box, the radiant warmer is completely open. That might seem counterintuitive. How can an open bed keep such a tiny baby warm? The magic is in how it delivers heat. It uses a heating element above the bed that sends down gentle, radiant warmth directly onto your baby's skin, much like the sun warming you on a cool day. This warmth is absorbed by the skin, keeping your baby's core temperature stable without needing to warm the surrounding air. Section 2. Why this bed and not an incubator? That leads to the next big question: why a radiant warmer instead of an incubator? The answer almost always comes down to one critical factor: access. The open design of a radiant warmer allows doctors, nurses, and respiratory therapists to see and reach the baby quickly and easily for exams, treatments, or procedures. If a baby needs frequent monitoring, help with breathing, or other hands-on care, the radiant warmer lets our team work without constantly opening and closing incubator doors, which can cause the temperature to fluctuate. Radiant warmers are often used right after birth, especially if a baby needs extra help transitioning, or for infants who are critically ill and require constant attention. An incubator, on the other hand, is a closed environment that's excellent for babies who need long-term stability with controlled temperature and humidity. Incubators are fantastic for very premature infants who need that womb-like environment to grow, while radiant warmers are perfect for those needing frequent medical care. Section 3. How does it keep my baby perfectly warm? It's completely understandable to worry if your baby is truly warm enough in an open bed. The way it works is actually pretty clever, and it all centers around one tiny component: the temperature probe. You'll see a small sensor, like a little sticker, placed on your baby's skin, usually on their abdomen or back. This probe continuously measures your baby's skin temperature and sends that information to the warmer's control unit. This is where the smart part comes in. The warmer operates in what's called a servo-controlled mode, meaning it automatically adjusts the heat output based on the real-time feedback from the skin probe. If your baby's temperature starts to dip even slightly, the heater will gently increase its output. If they start to get a little too warm, it will power down. This constant feedback loop creates a stable thermal environment, ensuring your baby's temperature stays right in that perfect, safe range. The system also has safety alarms that will alert the medical team immediately if the temperature goes outside the set range, ensuring your baby is always protected. Section 4. The benefits for baby and you. The most important benefit of the radiant warmer is that it helps prevent hypothermia, a dangerously low body temperature that is a significant risk for newborns. By keeping their temperature stable, the warmer helps your baby save precious energy that can be used for breathing, growing, and healing instead of just trying to stay warm. But there's another benefit, and this one is for you. Because the bed is open, it removes a physical barrier between you and your baby. You can see them more clearly, reach in to hold their hand, and feel more connected during care times. This open access can help support bonding during what can be a very stressful time in the NICU. It allows you to be a more visible and present part of your baby's world, which is so important for both of you. CTA. The technology in the NICU can feel overwhelming, but please remember that every machine, including the radiant warmer, has one single purpose: to support your baby. We encourage you to ask questions. If you want to know more about the warmer or any other piece of equipment, please talk to your baby's nurse or doctor. They are here to help you understand every part of your baby's care. Conclusion. So, when you see your baby resting in their radiant warmer, know that they are in a safe, smart, and carefully controlled environment. That open bed isn't a sign that they're cold, it's a sign that they are getting the dedicated care and close attention they need, while still being accessible to the most important people in their world, their healthcare team and you. It's a tool that provides life-saving warmth, giving your baby the support they need to grow stronger every single day.